So as we are aware at this point, SOLO2 was a maintenance trial of olaparib in a BRCA-mutated patient population. So olaparib maintenance after a platinum-sensitive recurrence, where you had at least partial, if not complete, response to standard platinum-based chemo. And then olaparib was used for maintenance. And important to know, when it's used for maintenance in the recurrent setting, you use it till progression or toxicity. So it doesn't have a cap at the 2-year mark. So this at SOLO2, at this ASCO, they presented the overall survival data for SOLO2. And as we could potentially predict, patients on olaparib had a significantly extended overall survival of about a year. And why is this so interesting? I mean, I think we expected that probably these patients were going to do better. I mean, they're BRCA mutated patients. They have essentially the biomarker for this medication. Why is it so surprising? Well, what's interesting about ovarian cancer is that traditionally we think progression-free survival is a more valid endpoint, just because these women get so many different treatments after their recurrence, and to compare their overall survivals to each other is like sometimes comparing apples to oranges. They have so much heterogeneity in terms of their future treatments. It's hard to look at overall survival. So when we see an overall survival difference in an ovarian cancer patient population, it's pretty amazing. And in this situation, really, we only have one other trial that demonstrated some overall survival improvement, and that was the use of bevacizumab in maintenance in the study GOG 213, and that was just a 3 to 6 month, depending on who you talk to, overall survival difference. So this is a year, and I think many of us are really interested in that. The fact that we can tell patients that actually, if you go on this maintenance therapy, not only are you going to recur later, but you're going to survive longer. And that's pretty impactful to tell that to a patient when you're dealing with a recurrent ovarian cancer patient. What's also noteworthy is there's some patients, potentially a quarter of patients, 28%, that when you put them on this PARP inhibitor for maintenance for their recurrence, that they never recur. And so, a quarter of them, you can say, a quarter of you are not going to recur at all after this olaparib maintenance for your recurrence. And that's also impactful and important to mention. I guess the potential 2 drawbacks are, number one, they reported a 8% MDS-AML rate for SOLO2 when they looked at the overall survival data, compared to 4% in the placebo arm. And so potentially maybe got to worry a little bit more about MDS-AML when you look at using olaparib long-term like this. And then the other interesting thing to consider is, even in the placebo arm, I think it was about 13% in the placebo arm never recurred. So definitely, as I've heard other leaders in this field, as I've heard them say, definitely there's a group of patients that don't need maintenance, and we don't know how to identify them. And it's amazing that in a recurrent situation, giving them placebo after their chemo, they never recurred, about 13% of them. And who were those women, and why were they cured that second time around and not that first time around? I mean, it's just interesting to look at those women and potentially consider them. But just to summarize, having data to demonstrate overall survival efficacy for women that are skeptical about going on this maintenance therapy, I think is impactful and definitely continues to be practice changing. Many of us have already started using this, now even frontline, and so to have some overall survival data just kind of justifies our use of it further.